I would like to direct the attention of the panel to a proposal Senator Wyden has been working on, bipartisan proposal. I'd be interested, Dr. Cutler, are you familiar with what Senator Wyden has been working on?
Yes, I am, sir.
Dr. Nichols, are you familiar? Mr. Capretta, if I could ask each of you in turn your opinions of what Senator Wyden has been working on, pros, cons, what could be done to tweak it, to make it better. Start with you, Dr. Cutler.
So first, let me say that I think Senator Wyden has shown an enormous amount of leadership on this, and I, as someone who studies this for quite a lengthy period of time, I'm really extremely encouraged to see that. I think where Senator Wyden started in his question is exactly right, which is that what we need to think about is how to structure the guarantee for seniors, citizens, that is something that they can rely upon, and that's also something that's going to be associated with cost savings for us. And I guess there are two components to that. One is setting up a functioning market for individuals to choose. As we know, as this committee knows, the Medicare Advantage program has been a mess over time. And so some of what Senator Wyden is doing is trying to replace the mess with something that actually works for people and for the taxpayers, and that's enormously important. I would then couple that with a management of the traditional fee-for-service program that turns that from a mess into something that works. And it comes back to the thought I was having as Senator Thune was asking his question is, we need a way to manage that program that doesn't make every single change be an impossibly high hurdle, because as we need to adjust rapidly as the private sector does, we need to be able to adjust rapidly in the Medicare program as well. And so where I go with Senator Wyden's proposal is to say, absolutely make the competitive part work, do the risk adjustment and the other sorts of things, and then couple that with a very aggressive look at the traditional program to make that work, and then really play it out so one doesn't have to choose either an entirely traditional program or an entire program without any traditional program.
Thank you. Dr. Nichols.
Well, the first thing I have to say in relation to Senator Wyden's proposal is I applaud the very instinct of bipartisanship. You know, Senator Conrad and Senator Wyden, too, how much time I personally spent in trying to make our last conversation more bipartisan as a nation. So I just think the more y'all do that, the better, and we'll all applaud. Second, what I like about the principles the Senator laid out in his comments this morning and what's there, you define a benefit package, none of this voucher coupon stuff. You make sure you're really going to make the government contribution to the fair competition between fee-for-service and the Medicare Advantage type plans. That competition, the payment is based upon the competitive bidding of the process. And I think we all would agree competitive bidding is way better than any kind of administrative fiat. It's going to work, and it has the virtue of reflecting the cost and the efficiencies achievable in different parts of our country. I know I don't have to tell y'all, it's a big country, it's very diverse, you're going to have very different levels of what's actually achievable. And third, I like the way that the risk adjustment and the consumer protections are emphasized when the Senator talks about it, and I think that is absolutely essential to going forward. How I would tweak it is a little bit along the lines David just said. I would really encourage y'all to think hard about reflecting the regional variation that's out there and think about what if you could grant discretion to a piece of Oregon or maybe the whole state. I know the governor there is actually pretty creative about these matters as well, or corners of Colorado, corners of New York, where there are people ready to do essentially what I would call real competitive action, but they need Medicare to be free of the rules that have been encumbered upon them. And so one of the steps is to have data available, but another step is to let Medicare actually structure something that might be different in one part of the world, as long as they're hitting the goals you set for the program. I think that's the hallmark, Senator. We want to move to a world in which y'all set the targets, you let the real world determine how to reach the targets, and you keep the beneficiaries protected. That's what you do.
Mr. Capretta.
Thank you, Mr. Chairman. I hope what I'm about to say doesn't hurt Senator Wyden in his efforts, but I very much applaud what you're doing. I think it's exactly the right direction to go.
Okay, you're killing him now.
Yeah, exactly. This is dead on arrival from here on out. The key in Medicare thing to understand is, remember there was a famous study about McAllen, Texas, that Atul Gawande put out in the New Yorker, and President read it, and it was passed around, and it was a very interesting article, very insightful, and it was all about the overbuilt system in McAllen, Texas, basically, procedure-based, heavy, overbuilt system. And the question is, why was it, the question that the article didn't address is, why in McAllen, Texas, was it so overbuilt? And a subsequent analysis later on basically pinpointed it on Medicare fee-for-service, that Medicare fee-for-service financed and underwrote the overbuilt system in McAllen, Texas. If you have a competitive system where someone can offer the Medicare package of benefits on a competitive basis, you won't have that happen anymore, because people will have to pay a much higher premium to stay in an overbuilt fee-for-service driven system like that. Competitive bidding will have the ability to weed that out of the system. And I think, so based on many versions of this goes all the way back to Bro Thomas in the late 90s and various versions since. On a bipartisan basis, I think there's general agreement that the best place to start in Medicare is a bidded system with fee-for-service participating, because that's the only way we'll ever really figure out what the right price is. If we try to figure it out on our own, we're going to either underpay or overpay, or probably both.
Well, I think there is enormous wisdom in your last observation. I've been here 25 years, and I'm personally convinced of what you just described.